If you have an allergic rhinitis, nose is running, and you use steroid sprays, and there's even an antihistamine spray, and is that the way to go now? Because the great concern about, especially young kids, using antihistamine, cough syrups, and all that kind of stuff. The American Academy now has come out stating with great concern about using it in 6 and under now.
Well, I think part of the problem with these over-the-counter medications is there has been no real regulation. There's been no very good directions as to how to use it, and I think the misconception with people is that anything that's over-the-counter is safe, and if it's safe, you can use it as much as you want. The same thing happens with decongestant nasal sprays. People have gotten addicted to them because they think it's over-the-counter and it's safe to use. So now with the antihistamine decongestant combinations that have been over-the-counter and now have caused some trouble, I think the majority of those problems have been caused by overuse or overdosing the children. I still think there's a role for those medicines, but they have to be used judiciously by the parent. They can't, just because the child has symptoms and is not responding, it doesn't mean that you give more and higher doses. Also, it's helpful to use some of the adjunct medicines that were mentioned. A child who has chronic allergies, that's a long-term problem. That's not something you're going to be able to treat with one of these over-the-counter medications. So either the child needs to be on some form of prescribed antihistamine or an antihistamine nasal spray. The trade name is Astelin. That is officially only approved for 6 and up also at this point, but that is something that's helpful. Singulair is a medicine that's considered quite safe and is approved for children under the age of 6 for allergies and asthma. So when someone has a chronic runny nose or chronic stuffy nose or any kind of symptoms related to allergy, the best thing to do is not to treat it on your own, but to really seek a physician's assistance, because there are a variety of safe yet prescribed medications that can be used to help a child, and it's better not to just use lots of over-the-counter medications.
Well, sometimes the triggers that you can figure out what causes it, sometimes avoiding those triggers might be better than even using some medications. That's right.
Right, absolutely. Sometimes it's obvious because every time a child eats strawberries, they'll break out, or a child that drinks milk and they break out or get diarrhea, and it's pretty obvious. Sometimes it's obvious that it's something environmental, such as dust, or mold, or a pet animal that has dander, or smoke. So there are ways of avoiding it. Some things, unfortunately, such as dust mite, are probably not completely avoidable. You can reduce teeth contact with certain types of filters, with certain sheet and pillowcase covers, but it's probably unlikely that if a child has a very substantial dust mite allergy that you're going to be able to avoid it completely, in which case other medications may be necessary. But that's again why it's helpful to consult a physician to help figure that out.